think very briefly, I just want to highlight the urgency that we are trying to get across today, right? There's a lot of things that are happening with Mpox. This is an outbreak that caused a global outbreak. We had a public emergency of international concern. There was some attention to this. The tension waned. There's an ongoing outbreak that's happening. We're talking about spread. This virus is being detected, particularly this clade 1b, which we know is more severe than clade 2, is being detected in a number of additional countries. There's certainly increased awareness. There's increased readiness in countries, which is excellent, and there is increased reporting. But this is detecting circulation, and this is something we want to act upon now. All of the things that can be done, and reiterate what Mike said, what Dr. Tedros has said, that this can be stopped if we actually put a concerted effort into this. We don't sit here and watch and wait, and we do not want the world to sit and watch and wait until, whatever that until is, to actually trigger some action. The time is now. The time was before, but let's talk where we are actually today and actually make the investment in Mpox that is causing significant challenges in many of the countries across the African region. We live in an interconnected world, and these pathogens do not respect borders. So I just want to get across the urgency that we're trying to say that the action is now, the time is now for us to take much more measures and provide much more support to the African region, to the countries that are affected across the entire spectrum, from surveillance to prevention to risk communication to clinical care to infection prevention control to R&D to the use of vaccines. It's now.
10 seconds. I think we've cast our minds back to the previous large increase of Mpox cases around the world, and we could sit here and say that the global scientific cavalry came to the assistance of the world and we stopped the outbreak. The outbreak of Mpox before, amongst SM in the main, was contained by that community, by a community that was informed, a community that was aware, a community that was engaged, a community that was empowered, a community that took responsibility and engaged with government in order to get the resources they needed. So again, I'm coming back. I don't want to poo-poo the science here. The science is important, and all of the work we're doing is important. But communities are at the center of containing an outbreak like this. And we have seen that in the field in the past. It is some of these communities, and certainly in Congo, are been living in extremes. We're dealing with areas in which there have been active conflict for decades and decades. Communities have been through the mill. They've been through everything: measles outbreaks, meningitis outbreaks, cholera outbreaks, war. They're resilient, but they need to be able to be brought to the center of this response. There are excellent NGOs on the ground, NGOs that have worked against HIV and others and made huge strides in reducing the incidence of HIV through awareness and education and access to antiretrovirals. So I think this is a community that we need to empower. These communities we need to engage, and we need to invest. And we need to match that then with the power of science and the power of surveillance, as Rosamund and Maria have so wonderfully outlined. But I really want to keep emphasizing this, that it's on the ground is where you stop an outbreak. On the ground with communities, with the proper teams, with the proper organizations, supporting a local community. And when we talk about the danger of international spread, it is relatively straightforward to stop a disease, even if it is spread internationally, if you know where the disease is, if you're able to detect it, if you're able to find cases, find contacts, treat those individuals who are affected in those communities, treat them with dignity, empower them, and they will help you to stop this disease. So I think we have to go back to the ABCs again, because sometimes in these situations we get lost, and we need to go back to basic principles of where epidemic containment begins and ends, and that is in our communities.
Thank you very much. Now we will Dr. Van Kerkhove.
Yeah, thank you. Just very briefly, just to use this as an opportunity to thank the countries that have increased their surveillance across the African continent, within DRC, but across the continent as well, and to utilize the capacities that they have for PCR testing, for sequencing, and to plea for more. So for us to be able to analyze these viruses that are circulating, to do the analysis and the characterizations of the different clades, because there are different outbreaks of Mpox that are happening, it is really important that that surveillance is strengthened, that it's supported, that the sequencing is conducted, and that information is shared rapidly. So we are seeing that happen, and we would like to see more of that because, as you've pointed out in your question, we need to be able to characterize these viruses to really understand the detailed epidemiology, because this will help us to have much more precise and tailored comprehensive response as we try to prevent transmission, to stop transmission, to provide care for patients, but also to utilize appropriate medical countermeasures like vaccines that need to be utilized in a targeted way. So it's a plea and a thank you for the sequencing that's being done, and to ask for even more as possible, and for that to be shared so it could be analyzed by an international group of scientists, which are meeting regularly to evaluate the ongoing viruses that are in circulation.
Thank you very much, both Dr. Lewis and Dr. Van Kerkhove. We have a number of questions, so let's hope we will go through most of them at least. So let's go to CBC and Lauren Pally from CBC. Lauren, if you hear me, could you please go ahead?
Hi, good morning, everyone. This question likely for Dr. Lewis again on the Mpox front. In the 2022 global outbreak, there was really distinct chains of transmission. The MSM community was largely impacted. Can you talk about the demographics and the populations you're seeing in these current outbreaks in Africa, and if you're seeing any different trends? And just one other question on behalf of a colleague as well, if someone could also comment on what WHO is doing with the Olympics to help protect athletes, given the rising number of cases of respiratory illness and COVID-19 currently. Thank you.
Thank you very much. There are two different questions. Dr. Van Kerkhove.
Yeah, maybe I'll start with this one. So I'll start with the second question first. So I first want to point out WHO, through our mass gatherings team and many different teams, works with the International Olympic Committee and the hosting governments to set up and to support the safe operation of Olympic Games. We've done this for many, many years, and we're doing so now with the Paris Olympics. There's an incredible amount of work that goes on between our teams and the teams that are putting these on to take this risk-based approach and to mitigate any potential infectious diseases, COVID and beyond. There are so many people that have come together. The DG talked about it in his speech today, where these games are operating safely. And it is such a celebration of actually bringing people together in a world of conflict that we live in. So we did clarify some comments that I made yesterday at the Palais briefing related to COVID at the Olympic Games, but we need to put this into context. Of course, there are going to be circulating pathogens, and there is COVID-19, but there's also, like we see in the community. But the Games and the Olympic Committee, the government of France, many partners that are there, put in place so many different measures to protect the athletes, and not just the athletes, but those who are coming to witness the Games and to celebrate the Games. So we are very happy and very confident in the comprehensive approach that the International Committee has said. I said this yesterday as well at the Palais briefing, in the measures that have been put in place. So that's the first question. On the second question, I'll let Rosamund perhaps come in and answer some of that. I think what we would like to see is much more detail in our understanding of the epidemiology of the Mpox outbreaks. Like I've said, and like Rosamund said before, what we really need is to understand the different ways in which this virus is transmitting, looking specifically at the age breakdown of the affected populations. We do see some differences in the age profile of the cases in different countries. We do have some information about exposures, and we know that there are multiple modes of transmission. We see transmission between family members. We do see some zoonotic transmission, but we also see sexual transmission in sexual networks. So that information is really important for us to better understand. So again, we can tailor the approach. We can ensure that on the prevention side, we have very strong risk communication, community engagement that's taking place, that we work with our local partners, we work with CSOs, we work with NGOs, we work with many different groups to help get that message across where people are showing up for healthcare to prevent those infections, but also, again, to tailor the use of any of the interventions that can prevent severe disease, that can prevent death. So we need more detail, I think, on the epidemiology. And I do want to thank, again, the field studies that are ongoing, the work that is being done in each individual country. We need more support for this. The DG mentioned this as well. Financial support for Mpox is required. We need to scale up the response to really tackle this as a multi-country outbreak, particularly looking at clade 1B, but also looking at the different Mpox outbreaks that are out there. And we, through our regional office, through our country offices, through our partners like Africa CDC and many others, I shouldn't name some if I don't name them all, really support what's happening in country. But we do need those financial resources to have a better understanding of the epidemiology, all the way through understanding the response, addressing research needs, et cetera.
Dr. Lewis, would you like very briefly to add something on a particular question?
Sure, thank you. Just briefly in response to the first question about demographics. So yes, we have noted just now that this virus is spreading through sexual transmission and through sexual networks. The DRC, Democratic Republic of the Congo, has good data on the cadres of individuals, if you will, in terms of their profession that are being affected by this. And whereas there was 1/3 of cases in the beginning of the outbreak were among sex workers, that proportion is now reducing as more people are being affected in the community. This includes students, businessmen, people traveling across the borders for different reasons, and those whose occupation is not reported. So we do know that this is transmitting through sexual networks, and we do know that this includes sex workers, which obviously there are commercial sex activities in the region, which include those necessary for survival, for income generation. And so everything that Dr. Van Kerkhove has said about risk communication, community engagement, and increasing access to vaccines all remains critical for this outbreak response. Some children have been affected already. At the moment, that proportion is not very great, but there are cases in areas such as internally displaced persons camps, as well as congregate settings. So it's a complex outbreak with myriad manifestations, and the response has to be contextualized, localized, to identify those at risk, and provide the information and resources they need to respond to this outbreak.
Thank you very much. We will move now to the next question. Gabrielle Emmanuel from NPR, and if it would be possible really to limit to one question only. Gabrielle?
Thank you very much. I am again curious about this Mpox situation and wanted to understand when the emergency committee may be meeting, and also where things stand in terms of getting vaccines to people on the ground as of now. Thank you.
So I can start again. So on the first part of your question, I'll just reiterate what the DG said, is that the emergency committee will be pulled together as soon as possible. So we have a roster of people that we will be contacting, and we will arrange this as soon as possible. We'll let you know. On the vaccine side, I know my other colleagues may want to come into this. And so we are working with many different partners. Again, DG mentioned this in his speech, of working with many partners to look at donations that are coming, that are available, directed donations, or how this will be managed. And we're very grateful for those who are coming forward to provide those donations. We're also, I'll let Deuce comment on the link to EUL and getting vaccines in country, but just to highlight that once they are in country, there's a lot of work that is ongoing looking at the protocols, how these vaccines can be used in communities. There are many people on the ground that have experience with this and in country to do this, as well to make sure that we have the targeted use of these vaccines. So many different things that are underway, but maybe in being conscious of time, I'll pass over to Deuce to comment on that.
Thank you, Gabrielle.